Hello, this video is for Columbia Southern University Community Risk Reduction course. My name is Mike Greenwald. I'm a battalion chief with Highlands Fire District, just outside of Flagstaff, Arizona. And the purpose of this assignment is to present a community risk reduction presentation to stakeholders within our community. In this case, it would be the fire board that we work for. This could also be in another municipality. It could be a city council or anything along those lines. So the point of community risk reduction is to provide a plan to recognize what in your community could be an issue and come up with a plan moving forward to reduce that risk within your community. Originally, for me, being in the heart of Flagstaff and an urban interface area, I thought that it would be good to present based off of the forest area and the urban interface. As the months have gone on, as everybody knows, we're facing COVID. So what we're doing here within district kind of reflects what I'm doing with my homework. And I've developed a community risk reduction plan based off of that and what we're facing currently with COVID. So within a community risk reduction plan, you have emergency response, engineering, enforcement, education, and economic incentive. You also, once you develop your goals, those goals need to be specific, measurable, assignable, relevant, and time related. So I'm going to go ahead and read you what we've come up with so far here at Highlands Fire District in conjunction with our partners in the City of Flagstaff and Guardian Medical and the hospital, the County Emergency Health. There's a number of different agencies that have been involved to help us develop our plan for COVID with community risk reduction. So the recommendation moving forward is pre-work screenings. Personnel shall be screened for COVID-19 symptoms prior to starting shift work and an additional screening on the morning of day 2. These screenings will include a temperature check and a questionnaire for other symptoms to include cough, headache, any known exposures to active COVID-19 cases, and shortness of breath. Personnel exhibiting any of these symptoms shall be sent home on sick leave. We've developed tracking sheets of current PPE inventories and projected needs. The spreadsheets have been developed that include our current PPE inventory. This list is compared to our current call load. It'll then be compared to expected needs based off of guidelines and recommendations from the CDC. Sorry for the background noise, I'm on duty here, and county health officials. Our EMS program manager will be responsible for tracking PPE inventories and projected need. This individual will also need to be in contact with vendors to ensure supply needs are met. We have decontamination and we have decontamination of equipment and station procedures that we've also implemented. We've developed shift staffing alternatives in the event that we have long-term or short-term absences. And it's key to remember that these are just short-term, ideally short-term patches in order to get our personnel back to work and get them healthy and get back to normal staffing levels. That's in the event that we actually, start getting sick here internally on district with a limited number of personnel. We have cost tracking measures in place. Our administrative personnel will keep track of all costs incurred during COVID-19. That includes personnel and backfill costs, cleaning equipment, and any increase in PPE accumulation and usage. That'll assist with future budget planning depending on how long this pandemic goes on. Facilities, effective immediately. Actually, a little while back, we went ahead and closed our community rooms within stations for public use. This is in an effort to reflect our desire to keep the virus out of our firehouses, and it'll be reviewed every 2 weeks. It has continued to be reviewed, and we're hoping to open up again soon. So the community impact it's data-driven to the best of our abilities. It's still mostly unknown within our small community. We are getting more data that comes in daily, so we're able to develop spreadsheets that can project our needs, but it's still mostly unknown on how this will affect us long term. It's an ever-changing situation, and we must do our best to stay one step ahead. Community impact will be dependent on multiple factors, primarily that of infection rates and serious illness. We must continue to provide a rapid and effective response to community needs. In order to continue to take care of our community members, we must also keep our personnel positive, productive, and healthy. Through planning and implementing safety measures internally, we can positively impact our community. Lastly, regular communication with our community members is important. We must be responsive to their needs and questions to help educate them on how to protect themselves. So, in summary, we have a lot of things that are currently in process. It's an ever-changing situation. It's something that we're monitoring pretty much daily, and we're adjusting as necessary as time goes on. We hope that we can continue to stay healthy and that our measures that we put in place are appropriate, and we'll continue to reevaluate those as this progresses. So thank you for your time. If you guys happen to watch this, then you are community members or board members, then feel free to reach out. Happy to talk to you. Thanks.